Greetings. This video discusses studies from 5 countries showing that even trace amounts of lithium decrease all-cause mortality. Decrease all-cause mortality does not mean that you will live forever, but it lowers the chance of dying from any cause. If in case someone develops a heart attack, stroke, or gets to an accident, a lower all-cause mortality means you have a greater chance of surviving that. Lithium is an element found in soil and water. Doctors prescribe lithium for mood disorders like bipolar disorder and depression. The dose can range from 600 to 1800 milligrams a day. I will cite the studies in this video from Europe, the USA, and Asia. They are from the UK, Finland, Texas, Japan, and Taiwan. I will present the studies from the earliest to the latest, as the newer ones build upon the previous studies. So let's get to them. In 1990, a seminal study, Lithium in Drinking Water and the Incidences of Crimes, Suicides, and Arrests Related to Drug Addictions, was published. The authors used data from 27 counties in Texas from 1978 to 1987. They showed that the incidence rates of suicides, homicides, and rape were significantly higher in counties whose drinking water supplies contain little or no lithium. In contrast, the reverse is true if lithium is in the water. The cases of suicide, homicide, robbery, burglary, theft, and rape were lower. The water lithium levels range from 70 to 170 micrograms per liter. Just as a review, there are 1,000 micrograms in 1 milligram. Therefore, 8 glasses of 250 ml a day or 2 liters amounts to about 0.5 milligrams or 1.36 milligrams a day. Fast forward to 2009, investigators from the Department of Neuropsychiatry of the Uita University in Japan examined lithium levels in the tap water in 18 municipalities. The total population studied was 1.2 million individuals. Then they calculated the suicide rates in all 18 municipalities. So here's what they found. So the size of the circle is the size of the population. So what they found is that the higher is the lithium level, which is expressed as a logarithm of the lithium level. It's not showing here, but the label is there. The higher the lithium level, the lower is the standardized mortality ratio or the suicide rate. So it turns out that one of the countries like Uita County is the biggest population, and it also has probably one of the highest lithium levels, and they have the lowest suicide rates. In contrast, other counties or municipalities that have lower lithium levels were observed to have higher suicide rates. They found that the lithium levels were significantly and negatively associated with the standardized mortality ratio for 2002 to 2006. That means the more lithium levels in the water, the lower the all-cause mortality. These findings suggest that even very low levels of lithium in drinking water may play a role in reducing suicide risk within the general population. In that paper, the Japanese authors were already asking how is it that low lithium levels decrease suicide rates? Because these trace amounts of lithium are not enough to control the mood. They cited a 2005 study by Müller-Orlinghausen et al. In Germany, which showed that even in poor responders to lithium prophylaxis for mood disorders, there's still a significant reduction in suicide attempts. The Japanese authors speculated at that time that very minute and very long lithium exposure may give protection to the brain, and the brain may need lithium for proper functioning, and also to make new brain cells, which might explain why the reduced suicide risk. Time will tell that their intuitions were correct. 2 years later, the same authors from Japan conducted a follow-up study. Low-dose lithium uptake promotes longevity in humans and metazoans. This time, they studied the effect of low lithium doses on a tiny roundworm, which is about a millimeter long, called Caenorhabditis elegans or C. elegans. They found that low concentration of lithium chloride extends the lifespan of roundworms. So why study the worms if they already know that low-dose lithium can extend the life of humans? And that's because worms don't commit suicide. So there must be something that lithium does to living things that makes them live longer. Their findings made them conclude. These findings indicate that low-dose exposure to lithium may exert anti-aging capabilities and unambiguously decrease mortality in evolutionary distinct species. The next study is from Finland, published by the Journal of Affective Disorders in 2015. It's titled "Lithium is associated with decrease in all-cause mortality, in all-cause and suicide mortality in high-risk bipolar patients, a nationwide registry-based prospective cohort study." So what's new in this study? This time the authors upped the ante. The study population only included severe causes of mood disorders. And how severe? All of them attempted suicide. They studied 826 bipolar disorders hospitalized in Finland between 1996 to 2003 because of a suicide attempt. The authors followed them for about 3.5 years. What the authors wanted to know is, 1, how many would attempt suicide, which would lead to hospitalization? 2, how many would die from suicide? And 3, what will be the overall mortality or all-cause mortality among these patients? Now, aside from lithiums, some of the 826 patients hospitalized were in other psychiatric medications like antipsychotics, valproic acid, antidepressants, and benzodiazepines. They found that those who use valproic acid, antidepressants, and benzodiazepines were associated with an increased risk of attempted suicide. However, lithium was associated with a lower risk of suicide attempts and with a significantly decreased suicide mortality. Moreover, lithium was related to a decreased all-cause mortality by 49%. In summary, this study showed that lithium decreases suicide rates and lowers suicide rates and all-cause mortality in high-risk bipolar patients who were hospitalized due to attempted suicide. But what about people with no mood disorders? Will lithium lower their risk of dying too? The following study from Texas will answer that. Recall that the previous Japanese study mentioned included 18 municipalities. This bigger study included 232 counties and showed that lithium concentrations in tap water were associated with lower all-cause mortality. Now, sometimes the level of education, employment, and income of the study population may affect the study's results, meaning people may be probably they have a better job, higher income, that's why they can afford lithium. But not so in lithium's case. In this study, lithium decreases all-cause mortality no matter what is the level of education, presence of employment, or income status. To recap, we have seen studies that show that lithium lowers all-cause mortality in trace amounts or prescription doses among those with and without mood disorders, regardless of educational level, income, and employment. Now, what about for people with chronic conditions? Will lithium also work? The next study, entitled "The Lithium Treatment Extends Human Lifespan," findings from the UK Biobank. And in this study, the authors are from Germany and Switzerland. The UK Biobank contains medical information on more than 500,000 individuals. The information includes medical, family history, surgical history, lab work, EKGs, genetic data, and imaging studies. In this study, they put together all patients with mood disorders into a category called F3. Now, what's F3? F3 is a diagnostic code, and one is hypomania, next is recurrent depressive disorder, next bipolar affective disorder, depressive episodes, and severe depressive episodes with psychotic symptoms. This graph shows us the survival probability versus the number of years lived. What it shows is that the individuals without F3 diagnosis, this one, also these are the people with no mood disorders, is that they tend to live longer than individuals with the F3X diagnosis. So their lives are shorter. The study results are in line with previous findings. Therapeutic doses, which is from 600 to 1800 milligrams a day of lithium, was linked to a decreased mortality in individuals with affective disorders. Now, what if people with affective disorders have other medical problems? Will lithium also decrease their all-cause mortality? Well, this table shows their findings. So in this group, there are two groups. So people that are not on lithium but have diabetes, blood clots, cancers, other serious medical conditions and disability, poor sleep, fractured bones, materially poor, and cardiovascular diseases. Now, if they are not on lithium, then what happens is that their survival is decreased. However, when they look at another group of people with the same medical conditions, but they are also on lithium for their mood disorders, then their survival is increased. They also found that lithium users have a 3.641 times lower chances of dying compared to users of other antipsychotic drugs. The next study, this time from Taiwan, followed 25,787 patients with bipolar disorders for 16 years. Now recall that the UK Biobank study only followed patients for 3.5 years. At first, they established the expected mortality rates for different conditions as a baseline. So this is the results of their study, and I made a spreadsheet for it. And what it shows here is that the standardized mortality rate for bipolar disorders, and with regards to their all-cause mortality, suicide, and natural mortality. So what it means is that if someone has a bipolar disorder, they are 5 times more likely to die earlier compared to someone with no bipolar disorder. They are 26 times more likely to commit suicide compared to someone who does not have a bipolar disorder, and the same thing with natural mortality, meaning just dying of natural causes. It's 4.68. Now, if they were on mood stabilizers, then the adjusted hazard ratio is much lower. So if someone has a bipolar disorder and they take mood stabilizer, then their hazard ratio, or adjusted hazard ratio, goes down from 5.26 to 0.58. So it's actually lower than expected. Suicide goes down from 26 to 0.6, and natural mortality from 4.68 to 0.55. However, if they separated lithium we studied lithium on its own, or in people who are taking lithium with or without other medications, then their adjusted hazard ratio is much lower compared to those taking mood stabilizers for all-cause mortality, suicide, and natural mortality. However, not all studies show an association between lithium and a decrease in all-cause mortality. A March 2024 study, which is just last month, published in Science, showed that lithium does not affect all-cause mortality. However, there's a difference in this study because the authors used the number and length of lithium prescriptions. Now, just because someone gets a prescription does not always mean that that person will buy it or take it as prescribed. And that's according to the authors themselves. And I agree with that because when I was visiting patients before, I will find that a lot of them would just put away their medicines. And actually, there's also a study that showed the same thing, that a lot of people are not compliant with their medications. Now, compared to the study that we had earlier, like the UK, the study in Finland where they studied the patients, they were hospitalized. So when you're in the hospital, they make sure that you take it, that they put it in their mouth and they swallow it. That's to confirm that they really took the medicine. To summarize, lithium is associated with a lower all-cause mortality from trace to therapeutic amounts. It does so independent of gender, level of education, income, and employment. In addition, studies from different countries have shown the association of lithium with lower all-cause mortality in populations with and without mood disorders. Ever since I have been reading about lithium, I started taking 5 milligrams a day. Who doesn't want to lower their all-cause mortality? It also helps with my blood sugar, but that's another study. Lithium orotate is available in Amazon, and I will provide a link below. At this time, I would like to express my profound gratitude to those who supported me. And if you think you profited from this video and can afford it, please buy me a coffee or two. Thank you for listening, and as always, don't get sick.